Hello and welcome to this very special show on lung care, Voice for Lungs. This is our very first episode of the series. And today we have with us Dr. Sushant Mittal, who's the Director of Medical Oncology. Join us as he shares his interesting insights about lung cancer as we delve into this interview with him. Can you tell us how long you've been in this profession for?
I've been since 2010. I've been into oncology, and I did my DM from Tata Memorial Hospital, Mumbai. And since then, after completion of DM, I've been practicing in Delhi. And oncology is something which is very close to my heart, and it's a opportunity to talk about lung cancer awareness because smoking, as we all know, is one of the major causes. So I hope this interview goes well and people are more aware about lung cancer.
To begin with, can you tell our viewers what lung cancer is?
Lung cancer, like any other cancer, is growth of abnormal cells. Every day in our body, old cells are dying, new cells are being grown. But there is a limit of to what new cells are being grown. So in lung, suppose today 4,000 old cells have died, 4,000 new cells body has to make. So in a normal person, though, after those 4,000 cells, the body will stop. That we don't require those cells. But for any reason, maybe smoking or any exposure to chemicals, stoppage mechanism is not there. So the abnormal cells get a chance to grow into the lung, and gradually from 2 to 4, 4 to 8, 8 to 16, they keep growing exponentially, and they make a lung mass which is not required by the body, and hence it becomes a lung cancer. So it grows into the alveoli, what is the balloons of a lung, into the pipelines of the lung, and then it starts spreading from there.
Are there different types of lung cancers and which is the most common one?
So, broadly speaking, we have two types of lung cancer. We have NSCLC, what is non small cell lung cancer, and other is small cell lung cancer. And about 70% of them are non small cell lung cancer. That is what the majority of our we are looking at. Then they are further classified at molecular level: adenocarcinoma, squamous cell carcinoma, EGFR positive, ALK positive, BRAF mutant, PDL1. So all those different molecular pathologies then get into role play, and that's how we divide the lung cancer.
If we look specifically at India, how prevalent is the disease here? Can you share some data stats about
Yeah,
this?
so world over, lung cancer is the fourth most common cancer, and it's the fourth most common cause of death in cancer patients. In India, it is the second most common, first being breast and then lung cancer. But in males, definitely it's the lung cancer which is second most common. And that is because we have in India various forms in which we take tobacco: the smokeless tobacco, the kheni, gutka, and of course that smoking, bidi, and then cigarettes, tobacco, and there's hookahs. All those things, they are the smoke ones which cause the most common causes of cancer.
Can you also share for our viewers what are some of the most common risks and factors which are associated with lung cancer?
The risk factors, most of us already know that. Smoking is the most common cause. On the cigarette packs, it's written that it's the most common cause. And in smoking, it is just not cigarettes, it is bidi, hookah, and then we have, I'll talk about the vapes also in a while. And this smoking, they have heavy metals in them, such as cadmium, chromium, lead. So when you inhale these, they go into the lung and they start getting deposited. Along with the pollution what we have, especially in city like Delhi where we have so high AQI, these heavy metals, these pollutants, they get deposited into your lung, and gradually over 30-40 years they cause damage to the DNA. They start infiltrating the lung lining, and gradually the DNA damage happens, and the normal repair mechanism is hampered. In a body, repair is happening every day. Wear and tear and repairing is happening, but the repair mechanism gets affected because of these smoking. And over 30, 40 years, as I told you, these small abnormal cells starts accumulating and they cause a mass. Now we have other factors also. Many a times I talk to people who smoke, they say who are not smoking, they also get cancer. So why us? Why you are targeting us only? Why are you giving your knowledge to us only? I said that's true, but that's population is just about 10 to 15% who have the cancer because of non-smoking, and that is probably a occupational hazard like mining industry, cement industry, iron, steel industry. If the proper precautions are not taken by the workers or the miners, then they get exposed to these dust material like asbestos, and gradually they get deposited into the lung. So anything which is abnormal having being exposed for a long time causes damage to your lung. We have radon exposures also. Now we have so much use of pesticides in our food, in our various food what we are eating. So those things also gradually damage your DNA repair mechanism. Also, in smoking, if we come across second hand smoking or passive smoking, what we say, is another reason. Spouses who are not smoking have partners who are smoking, so they get exposed to the passive smoking, and gradually over 30, 40 years they get exposed. Initially, when we had chulha cooking, female used to blow into that chulha, and that indoor pollution was very high. Those patients were also exposed to these coal or wooden burns, which smoke, which is going into their lungs. So these are the various factors which causes lung cancer.
And if we talk about smoking specifically, there's a recent trend amongst the youth, the youngsters. They have taken to e-cigarettes or vaping. In some countries, vaping has also been banned recently because of its harmful effects. Can you share a little bit about how does this really affect? Is it safe?
So there's a lot of buzz about it, and especially amongst the youngsters or maybe people who are trying to quit smoking, they get into that habit of e-smoking or whatever we call it as vape. Definitely, it has some side effects on the lung, but we don't have adequate studies as of now to show that they will cause lung cancer because the duration when it has been launched and the studies is very short. But logically speaking, something is going into the lung which is chemical, which is not required by the body. So, scientists feel that it will cause some damage to your lung, definitely.
And if we talk about the leading cause of lung cancer, what would that be?
Smoking would be the leading cause of lung cancer, followed by first would be active smoking, then with the passive smoking, and then occupational hazard like chemical industry or cement industry, all those things would be there.
And you know, you've been in this field for a very long time. I'm sure you must have come across a lot of cases. Is there any one particular case that strikes out the most to you that you would like to share with our viewers also?
Yeah, definitely. I think it was 2017, and I had this patient of lung cancer whom we gave about 2 to 3 different type of chemotherapies, and he used to respond for some time. Then after few months he used to progress, then we used to give him second line, then he responded, then after third line he wasn't responding, and he was on ventilator, very bad situation in ICU. So his family was like, what can we do, is there anything? So that immunotherapy had been recently launched that time and it was not available in India. So we told the relatives that this is the drug which is available, and it's not at present available in India, but outside India it's available. So if you want to give it a try, we can give it a try, and but it would be a lot of paperwork has to be done to get those medicines. So I said we are ready for that, and I had shoot some emails and prepared those license, and so we got that drug and we gave, and the patient started responding. And after about first cycle itself, he was off ventilator, And gradually, when we were able to give further cycles, and now the condition is that he comes alone on his scooter, takes the immunotherapy, goes back to his home. He's so well. So it's just about 30-40 minutes of injection. And that's what the research and development has done, that we are able to save lives at uh, for a longer time. So that incidence always remains in my mind.
And that is a very inspiring story for a lot of people who would want to get cured for this. And is it too late to quit smoking for somebody? When is it too late and when should they really stop?
It is never too late to stop smoking. As soon as you stop smoking, your blood gets better circulation in the body. It gets thin and the circulation gets better. Although for first few weeks, few months, it is really difficult mentally and physically also, because it causes dependency. But internally, the body starts healing itself because you're not exposed to those harmful chemicals. And 10 years down the line, when you've stopped smoking, your risk of having lung cancer or having cardiovascular disease or stroke because of smoking reduces by more than 50%. And by another 20 years, you are at par with the normal population who is not smoking. The risk remains significantly low for you. The most common reason for starting smoking is, I'll tell you, in the class 11th and 12th. Reason being, you have just passed your 10th exam. That is something big in India. And if you do well, you feel elated. And then that you are have become a teenager, you have that hormonal surge and that style statement, and to look cool, you tend to start smoking with your company, with your friends around. And I have had so many patients whom I asked. Now, though I don't ask only. I said, you must have started smoking when you were 16, 17. They say, yes, doctor, we started that time. So that is the tender age when one should take care of the kids and to teach them or to make them aware of such things. I remember my 11th also. I was also uh, exposed by my senior. Ki, let's go and have a puff and start smoking. But God has been kind, so I never had that habit. But yes, that's the tender age when all these things starts, and then it becomes a habit. And then in the stress or happiness or whatever the occasion is, uh, people are smoking.
If we talk about this age, it's also the same time when a lot of people start smoking marijuana. And
Yes.
what are the risks associated with that? Does that also lead to lung cancer?
Yes, marijuana has a lot of carcinogenic potential. Alone marijuana has not that much risk as the cigarette, but who are smoking a pot do have the habit of smoking cigarettes also, because all the time you can't have marijuana. So when they don't have, probably in the office time or their working atmosphere on the home, so they start smoking, and that adds to it. So these together as a habit forming further damages your lung.
So, for somebody who wants to, rejuvenate their lungs and wants to maybe stop smoking, what are some tips and advice that you can share with them?
The most common is one has to have awareness. Awareness everyone has, but the determination or the motivation. In my professional life, in my scenario, that is probably the fear of death when they are diagnosed or when they have a apprehension that yes, they have that lung mass or that can be cancerous. They immediately stop it. But before that, you keep telling them, somehow or the other they will smoke. Ki, I had this tension, I didn't have a good working atmosphere, my kids are not doing well, or my parents are not taking care of me for whatever reason. Smoking has become a habit, and probably people who are in so much habit that they can't pass motion and they are remaining constipated without smoking. So early in the morning they start smoking. So one has to have a lot of motivation, self determination, and you have to have that company, which is very difficult for that your colleagues are smoking and you want to stop smoking, and they said, oh come on, nothing happens with one puff. So you need to have a lot of determination, motivation, and second of all, regular exercises, jogging, meditation, and then habit of having something in the finger and puffing it off. So that's why that e-cigarettes came into the market, but they are also not safe. So something that stress busters came, that kids have, that they keep rotating, that something happens in their hand. And other is then nicotine chewing gums. So one can have that. You can start with, suppose you are taking 7 cigarettes in a day. So instead of that, have 7 nicotine chewing gums. Then after 1 week, make it 6. Then after 1 week, make it 7. So that that nicotine kick gradually weans off. Immediately, if you are very determined, very motivated, you will be able to leave. But if not, then this is the way that you gradually wean off from smoking that nicotine and do the things better. I have told many of my patients, then they start having tobacco, the chewing tobacco. I said, this is a catch 22 situation. एक तरफ खाई एक तरफ हुआ. So it is better that you take chewing gum rather than having those tobacco or those pan masalas and all those things.
Some symptoms and some effects that people go through, and that's when they should know that they should go for a health checkup. Can you share what are these that people should look out, especially for smokers?
Yeah. So early sign and symptoms, what you are asking, and it's very important that people are aware of these early sign and symptoms. In smokers, usually they do have cough and seasonal breathlessness, COPD or asthma, and they take whatever inhalers they want to take, they take, and then they get better. But if you have a cough which is lasting for more than 1 month, one has to get it evaluated. It can be tuberculosis, it can be a chest infection, it can be a lung cancer. So one has to get it evaluated. Other thing is that you are spitting out blood, you are losing weight without diet or without exercise. There is a, in the evening you feel fatigue and there is a low rise in temperature about 99-degree daily you are having. You don't like eating, and there is some neck swelling. You find it on your this neck, around the necks or in the armpits. And in some patients, if it's a back pain, because sometimes the lung cancer spreads to the spinal vertebra and then it causes a back pain. So these early sign and symptom, one should go and get them evaluated. People, what they do is just take some inhalers, some painkillers, and they don't get it evaluated. But one should get these signs early, to go to a pulmonologist, go to a physician, get them evaluated, and you are able, so that we are able to pick them up at an early stage.
Right. And lastly, because right now we're living in cities like Delhi, Mumbai, Bangalore, all of them are facing high levels of pollution. So even for non-smokers and more so for smokers, are there any precautions like wearing masks or anything specifically that people should do to take care of their lungs?
So yes, mask is one thing which is there, but uh, try and avoid passive smoking. If you don't like it, you say that I don't want. Tell the other person to smoke somewhere else. And during these winters, if you want to go and jog, you want to exercise, do it when the sun rises, so that that condensation, that smog little gets cleared, and then you are able to do so. Also, eat healthy fruits and vegetables that most of us don't eat. But believe me, these fruits and vegetable, whatever we used to study in class 5 moral science, green leafy vegetable, fruits, they have a lot of antioxidants. Those antioxidants act like a scavenger and take care of the heavy metal whichever whatever is deposited in the lung, and they take them outside the body and detoxify your body. So one should follow that.
Thank you, Dr. Sushant, for sharing these insights with our audience. We will be back with 3 more episodes of Voice for Lungs. Till then, stay tuned and thank you for watching.